climate change very related to health. For example, summer extreme heat stroke and all, and also rainy season, vector-borne diseases also increasing. Winter and extreme cold also, respiratory problem, wheezing, breathing difficulty.
Young people ge climate change inda ಏನೇನೋ ಆಗ್ಬಿಡುತ್ತೆ ಅನ್ನೋ ಭಯ ಎಲ್ಲ ಶುರು ಆಗಿದೆ.
City claims $350 billion as its annual GDP. It can do better in terms of increasing livability for its citizens so that they're better prepared for climate change and the health consequences.
Real action on climate change, frankly, can only come.
When it comes to health and climate change, the World Health Organization recognizes it as a serious risk. Research shows that 3.6 billion people already live in areas highly susceptible to climate change. And our city is no exception because we're also faced with waterlogging and heat issues. And the WHO also says that between 2030 and 2050, climate change is expected to cause approximately 250,000 additional deaths per year, not to mention the impacts on disability and the question of being productive economically and the cost burden that has to be taken up by the health system. So let's try to understand the health issues of our city, Bengaluru, and layer it with climate change. Who is affected? Who is most vulnerable? And how do we go about trying to find solutions to the impact that climate change will bring on our city? So we have with us Prashanth NS, Director of Institute of Public Health. Welcome, Prashanth.
Thank you.
He works at the intersection of healthcare and health systems with ecological and social systems with a particular focus on health inequities, right? And that's a critical component of justice, social justice and equity that we work on. You also work on social determinants of health. We also have Sukanya with us, Program Manager with Swasti Health Catalyst. Her focus spans public health, climate health, gender equity, workforce well-being, life skills training, financial management, social protection, ensuring holistic and sustainable impact in both workplaces and communities. And you also work with school children, as you were telling me. So, Prashanth, ನಿಮ್ಮ ಜೊತೆ ಪ್ರಾರಂಭ ಮಾಡೋಣ. ನಿಮ್ಮ ಸಂಸ್ಥೆ ಏನ್ ಮಾಡುತ್ತೆ? How do you engage with the community from the health perspective, and what are you seeing happening on the ground?
15-20 ವರ್ಷದಿಂದ ಈ ಒಂದು discipline, the idea of public health is only an emerging thing.
Right.
But for a long time, I think in post-independence India, we've had a huge recognition that there is a lot of need for healthcare in remote rural parts, in cities, etc. So you've had what is called as community health movements.
So it's moving from individual health to community health as a concept and as a way of engaging with
Correct.
health systems.
In fact, individual health, community health, and now in public health, we talk of the need for governments and the state responsibility
Right.
in steering health. Because one way to look at health is ಎಲ್ಲರಿಗೂ ಹೋಗಿ ನಾವು ಹೇಳ್ಕೊಡೋದು ನೀವು how to be healthy or health education, the classical thing. Oh, people are ignorant, so we go and tell them how to be healthy and then health will improve. Decades and perhaps even centuries of work have shown this does not work. If as a society we have to be healthy, we have to make investments in governing health. For example, climate change is a classical example. It's not only individual action. There's a lot needed at individuals, but societies and governments have to work
together. That's a very important point. And Prashanth, we also talk about One Health these days, and we say that the ecosystem health, the health of biodiversity, plants and animals in our system, and human health are all three interconnected.
Yeah.
And therefore, as you rightly point out, community health itself has to be placed in this One Health concept, right? So what do you see as some of the health challenges at a community level, especially for vulnerable groups where you are working with?
So I'm glad you brought up vulnerable groups and social determinants, because I feel, and I'm saying it a little bit provocatively, the climate movement, at least at the global and national level, has not contextualized it to the lives of millions of citizens who are struggling with very different set of issues. It's not like many people they need to be educated about heat or climate change.
Right.
They are aware of it. But there are very many existential dilemmas, employment, and ill parents, debt traps. These are all deep social problems that are preventing conversations to be on climate change to be able to be absorbed meaningfully, I think, by many vulnerable communities.
That's a very interesting point. I mean, we'll come to the particular characteristics of Bengaluru and the local residents themselves who occupy vulnerable spaces from not just the physical vantage point, but also the social and economic vantage points. And these are the challenges that you're highlighting. ನೀವೇನು ನಿಮ್ಮ ಸ್ವಸ್ತಿ ಸಂಸ್ಥೆ ಯಾತ್ರ ಬಗ್ಗೆ ಕೆಲಸ ಮಾಡ್ತಾ ಇದ್ದೀರಿ ಸುಕನ್ಯಾ ಅವರೇ, ಮತ್ತೆ ಏನು ನೀವು ಯಾತ್ರ ಜೊತೆ ನೀವು ಎಂಗೇಜ್ ಮಾಡ್ತಾ ಇದ್ದೀರಾ?
Swasti majorly we dedicated to work for public health outcomes and especially socially excluded communities. And also we work health, livelihood and community system strengthening as well. These are the main thing. And also in the community, especially in the majorly we are focusing on preventive and protective aspect, health. We can prevent many health diseases.
Right.
We start that way, and primary healthcare aspect and public healthcare aspect we are working in the community. And especially in the community, people, they know. We not think about they don't know anything, but when come to practice, they are not prioritizing health.
Right.
Okay, their health is second priority, third priority. Their priority is other else. But we are make them to realize why health is important, how it will be affecting to their day-to-day life, and also their income, productivity, and how overall affecting to their overall well-being.
So that's a very interesting point you make, Sukanya, about preventive health and communications with the community itself to make them realize what the challenges are, which they know already, but to get that into action, right? That is the...
Yes, but easy make them to understand what is the health issues presently in the community, how they can prevent it. For example, we are quoting them, waterborne diseases, for example, due to heavy rain during rainy season, what can preventive measures they can take it. When we are asking, okay, what kind of water you are drinking? Directly tap water. Yakendre Kaveri water, pure water. Their mindset, changing mindset is the very challenges. Make them give information, knowledge, certain skills. But adapting and practicing is main challenge.
So you make this point about services itself and the current state of services, which then determines vulnerability. For example, if we were to get good quality tap water, which is portable 24/7 in our taps, then we need not worry too much about water quality itself, right? But because we get intermittent supply, it has to be stored, and therefore we need to become aware of the quality of water that we consume, and then we have to take action, right?
Yes.
So that's the response. So there is this layer, Prashanth, of service delivery, which has a crucial role to play in health. And therefore, some solutions to health can actually come from engineers who design better water and sanitation systems. Would that be right to say?
Absolutely. ಇವಾಗ ನಾವು ಪಬ್ಲಿಕ್ ಹೆಲ್ತ್ ಅಂದಾಗ ಇಟ್ಸ್ ನಾಟ್ ಡಾಕ್ಟರ್ಸ್ ಆರ್ ನರ್ಸಸ್ ಆರ್ ಫಾರ್ಮಸಿಸ್ಟ್. ಪಬ್ಲಿಕ್ ಹೆಲ್ತ್ ಇನ್ಕ್ಲೂಡ್ಸ್ ಎಡ್ಯುಕೇಟರ್ಸ್, ಇಟ್ ಇನ್ಕ್ಲೂಡ್ಸ್ ಸಿಟಿ ಪ್ಲ್ಯಾನರ್ಸ್. ಸಿಟಿ ಪ್ಲ್ಯಾನರ್ಸ್ಗೆ ಎಷ್ಟು ಇಂಪಾರ್ಟೆಂಟ್ ರೋಲ್ ಇದೆ. ಇಷ್ಟೊಂದು ಹೇಳ್ತೀವಿ ನಾನ್ ಕಮ್ಯುನಿಕೇಬಲ್ ಡಿಸೀಸ್ ಬಗ್ಗೆ, ಹೈಪರ್ ಟೆನ್ಷನ್, ಡಯಾಬಿಟೀಸ್. One is to go on telling people, oh, don't put salt, reduce sugar. I will go and educate them about, physical activity.
Right.
That is an important approach, like what Sukanya is talking about. That's also important. But the elephant in the room is, where do people do these exercises? What kind of spaces is the city providing so people can enjoy the benefits of physical activity?
Right.
Alva? Then there's the role of parks. So if you want less diabetes and hypertension, so like you're saying, engineers and city planners plan more parks, plan more inclusive spaces where parks can invite all age groups, all different socio-economic categories. Who knows, parks may become Climate Charche places. Maybe citizens will gather together and say, what is happening in Bangalore, heat stress, even better than educating people.
So that's a very good point that you make, that a livable, walkable city where you can walk on the roads or in the footpaths, have community spaces like parks which are public, which are available to everybody, and lakes of Bangalore, for example, where you can protect the lakes, but also use it for your recreational activities and your physical activity. Both of them, there's the physical component of it and there's the mental component of it, right?
Absolutely.
Talking with people, the community itself is part of healthy person process. Is that...
Absolutely. I'll just take a short minute and explain some very interesting mental health you brought up.
Right.
The Zimbabwean, I don't know the name, friendship bench ಅನ್ನೋ ಒಂದು intervention ಮಾಡಿದ್ದಾರೆ. It's very, very nice. The idea is, in public spaces, you create a bench or a space where anyone sitting there signals either offering help or providing help. What does help mean here? Conversation. So I'm not feeling well today. I go and sit on a bench. It's like an invitation that I'm hoping to have a conversation with a stranger. So very interesting things can happen. Of course, this can also happen in, it's not comparable to a therapy, which is a very structured approach.
Right.
But for millennia, societies have helped people with mental health issues through conversation, through strong relationships, etc. So public spaces, if reimagined in that manner, can become not only climate friendly, they can become health promoting.
So that's a fascinating insight. Many wouldn't be aware, including me, for example, that there are different disciplines of designers, policymakers, service providers. The city fabric itself, which can improve health conditions of the citizens and bring about better outcomes in both physically and mentally. True. So one of the other studies that I seem to have read is that if you spend 15 minutes at a lake just gazing at the water and have calmness around you, that improves your mental health to a large extent, which is a benefit that we don't see when we see it as a physical object, as a water body. But the kind of interface that people have with that water body can itself release stress and then give you calmness to a certain extent.
Absolutely.
Absolutely possible.
Yeah. And also adding for this Swasti, we are focusing not only physical health, and we are also focusing mental health aspect in the community, especially because physical health sometimes lead to mental health problem. Because when they are sick, ill, due to that they are absent to the work, their productivity loss, they lost the income, and their overall it will affect to the again family crisis thing, and also it will be increasing stress, anxiety that leads to mental health illness as well.
Yeah, and I remember that in the conversation we were saying that you also work on occupational health,
yes.
A bit of a focus on that. Would you want to sort of elaborate on how occupational health is addressed by you?
Yes, actually in the workplace also we have such a design health and well-being program for the workforce, especially factories where the
garment
most
workers,
garment workers, especially majority of 80% are women are working there.
Women are working
Yeah,
there.
women are working, and the majority percentage of especially Bengaluru, they have migrant workers also.
So they're temporary and permanent migrant.
Temporary and permanent migrant, and temporary in the sense also within the state also migrant. Correct. Other district and also other state, Andhra, Tamil Nadu, Orissa, Assam, these many states also they migrant workers. They are also facing challenges occupational where they are staying very congested, very small houses and no ventilation facilities and all. When come to workplace, when we are interventioning health especially and including climate health as well. And earlier we also thought of only NCD and general expressed illness we are treating and during the camp.
So when you say NCD is non-communicable
diseases, yes.
Yes.
And even studies says, and even though during our camps also after result when we analyzing more than 50% are women anemic and above 15 to 20% are hypertensive and
right.
more than 10% are diabetic. We help them to majorly prevention aspect and we educate them to how to prevent it before getting anemia, hypertension and diabetic. If they are already identified it, how they can manage very well using lifestyle modification, healthy habits and all. And if they are already in the severe stage, where they can go access the treatment.
Right.
This part we are focusing. That time also we identified during especially summer time only, especially many women during our screening coming with expressed illness. For example, I not feel like to have food, very tiredness, unable to do my work, I'm not able to reach my production. These kind of small thing, and also rashes, and also skin irritation, and also bleeding on nose. So these kind of we are as nurses start of asking clinically some questions, how much they water drink, what food they had it, very connecting to, very related to climate, because they thought understanding, okay, I'm working in the machine, madam, long 8 hours I am sitting, this is power connected, because of heat I am getting this, very difficult I'm working this kind of work. We help them to understand why they are getting, what is the temperature outside, because of extreme heat, what are all these health issues, how they can prevent it, drinking lot more water.
But I'll just push this question to Prashanth itself. Yeah, it's very interesting what you put out. Now, drinking a lot more water is related to access to toilets. A lot of time, occupational people, especially women, just don't drink water because there's no sanitation facilities available. So, design has a great role to play in sorting out many of the issues, which, as Sukanya was pointing out, comes from a deeper understanding of the people that you're working with.
Just to build on the design issue that she very, very beautifully explained. So, one is to educate. ಈ ಥರ ಮಾಡಬೇಕು ಅಂತ. But what if the city does not have a good quality public toilet system?
Exactly.
You know, and this is, I mean, it is definitely clearly gendered. Women struggle much more because, on the other hand, you also have this, it's not only an Indian thing, in multiple countries in the south where people say, oh, people are unclean. It's often that amenities are not available.
Right.
So why do you see open defecation? Why do you see, the kind of thing is also because of amenities.
Correct.
Bus stands, busy places, needing to build these things.
And also, ಈಗ ಫ್ಯಾಕ್ಟ್ರಿನಲ್ಲಿ ತುಂಬ ಅವರಿಗೆ ಟಾಯ್ಲೆಟ್ ಫೆಸಿಲಿಟೀಸ್ ಎಲ್ಲ ಇರುತ್ತೆ. ಇವನ್ ದೋ ನಾನು ನೀರು ಕುಡಿದ್ಬಿಟ್ರೆ ಟಾಯ್ಲೆಟಿಗೆ ಹೋಗಬೇಕು, 5 minutes 10 minutes ವೇಸ್ಟ್ ಆಫ್ ಟೈಮ್, ಮೈ ಪ್ರೊಡಕ್ಟಿವ್ ಇಲ್ಲ. ಸೊ ದಟ್ ಮೈಂಡ್ ಸೆಟ್ ದೇ ಹ್ಯಾವ್. ದೆನ್ ವಿ ಮೇಕ್ ದೆಮ್ ಟು ರಿಯಲೈಸ್ ಅಂಡ್ ಅಂಡರ್ಸ್ಟ್ಯಾಂಡಿಂಗ್, ಇಫ್ ಯು ನಾಟ್ ಡ್ರಿಂಕ್ ವಾಟರ್, ವಾಟ್ ಆರ್ ಆಲ್ ದ ಹೆಲ್ತ್ ಇಶ್ಯೂಸ್, ಇಫ್ ಯು ನಾಟ್ ಯೂಸಿಂಗ್ ಟಾಯ್ಲೆಟ್ timely,
UTI.
and what UTI issues and other issues will come. We made them realize, and also we sensitize the management also.
Exactly, that's
give
very
the break
important.
and they can also ensure. And one factory, for example, where we trained and sensitized the management also, what they done after that, why drinking water, many women's not ready to drink, even the floor they are keeping the water bottle availability, everything, and they started to put music. Every at least half an hour, 1 hour, water music. Employees should be remember, because they are focusing their work only. They are not, even though thirsty also, they not go and drink. And when they put music, they should go and drink the water. This is the best practice to ensure and practice.
Very interesting design intervention. This is a sort of conditioning that we are sort of implicitly unaware of till we are made aware of, and then you find solutions to it, right? Yeah, Prashanth.
I just wanted to come to that. This is somewhat, even garment work, etc., we can say it is somewhat organized.
Yes.
Because there is still, it's not like, but what about fully unorganized? Like, take example, the Ola, Uber, Swiggy,
Right.
Zomato, all of these people are living. Street vendors. These are people living about 8 to 10 hours on the streets. ಇವಾಗ ಇವ್ರು ಹೇಳಿದ್ರಲ್ಲ, ಎಂಪ್ಲಾಯರ್ ರೆಸ್ಪಾನ್ಸಿಬಿಲಿಟಿ ಅಂತ. Unfortunately for the Swiggy, Zomato, Uber and all of this new age employer, there's no employer.
But you were also discussing the role of migrants and health and in the city. Would you share your experience on that?
Many people come to Bangalore to find employment, a life, a better life, and things like that. Many of these people are also running from social stresses, livelihood stresses and social stresses of various kinds.
Right.
By social stresses, what do I mean? Sometimes, I've seen, because I've spent a long time in Chamarajnagar, in many times young people are running away from social norms which are very adverse.
Right.
ಯಾಕೋ ಅವ್ರಿಗೆ ಹಳ್ಳಿನಲ್ಲಿ ಅವ್ರಿಗೆ ಬೇಕಾಗಿದ್ದ ಫ್ರೀಡಮ್ ಸಿಗ್ತಾ ಇಲ್ಲ. ಏನಾದರೂ ಇರ್ಬೋದು. ಇಟ್ ಮೇ ಬಿ ಸೆಕ್ಷುವಲ್ ಓರಿಯೆಂಟೇಷನ್, ಇಟ್ ಮೇ ಬಿ ಅಬೌಟ್ ಕಾಸ್ಟ್, ಇಟ್ ಮೇ ಬಿ ಅಬೌಟ್ ಆಸ್ಪಿರೇಷನ್ಸ್. ಸಿಟೀಸಲ್ಲಿ ಆ ಒಂದು ಇದಿದೆ, ನಾನು ಅಲ್ಲಿ ಬೆಂಗಳೂರಿಗೆ ಹೋದರೆ ಏನೋ ಹೆಂಗೋ ಜೀವನ ಮಾಡ್ಕೊಂಡ್ಬಿಡ್ತೀನಿ.
I can escape that and I can make a livelihood at the same time.
So cities have that attraction, both positive but also negative. The negative being these things. Our cities are not able to provide amenities, welcome and give a healthy environment unless people like Sukanya and others are investing in this kind of connection making.
Right.
That's the struggle.
Prashanth, I should just add, I had a conversation with one of the Uber drivers, and one of the facts he was mentioning is that he was actually sleeping in the car. And the best thing that happened to him was that in the airport, they provided him with bathroom and toilet facilities and a place to rest. Right? So simple things that the public institutions can do is to recognize the conditions that our migrants and our workforce is living in and try to make services accessible to them. And that's the next question that I have for both of you. How do public institutions of the state be engaged in these kind of problem identification and solution seeking in the era of climate change?
First, I feel they have to, I'm not sort of laying blame on BBMP, etc. But first, feeling responsible,
Right.
now fail aagta idivi. Because, and it's the same in health. Let me give a health parallel. You see increasing privatization of healthcare in the country. One is to see economic opportunity. Hospital is also an investment. If I have a few disposable crores, I can pull it together and open a new chain of hospital. It's profitable. But on the other hand, what this also creates is a large lack of regulated health sector outside the government. Now, if governments do not consider that all of this private healthcare is also important for us to regulate, I have to know what's happening there.
Correct.
Quality ಏನಿದೆ. But if governments do not think it is our responsibility is government health centers, ಅದು ಪ್ರೈವೇಟ್ ಸೆಕ್ಟರ್ ಕಂಪನಿ ಅವರು ನಡೆಸ್ತಾ ಇದ್ದಾರೆ. ಹೆಲ್ತಲ್ಲಿ ಒಂದು ಎಕ್ಸಾಂಪಲ್ ತಗೋಬೇಕಾದ್ರೆ 2005 ನ್ಯಾಷನಲ್ ಹೆಲ್ತ್ ಮಿಷನ್ ಅಂತ ಲಾಂಚ್ ಆಯಿತು. ಈಗಲೂ ಫಾರ್ ಎಕ್ಸಾಂಪಲ್ ಆಶಾ, ದ ಐಡಿಯಾ ಆಫ್ ಕಮ್ಯುನಿಟಿ ಹೆಲ್ತ್ ವರ್ಕರ್, ಆಶಾ ಕಾರ್ಯಕರ್ತೆ ಎಸ್ಪೆಷಲಿ ರೂರಲ್ ಅಲ್ಲಿ ತುಂಬಾ ಚೆನ್ನಾಗಿದೆ. ಅರ್ಬನ್ ಬೆಂಗಳೂರಲ್ಲಿ ಅಷ್ಟು ಆಶಾ ಕಾರ್ಯಕರ್ತೆಯರೇ ಇಲ್ಲ. ಆಕ್ಚುಲಿ ಕಮ್ಯುನಿಟಿ ಹೆಲ್ತ್ ವರ್ಕ್ ಫೋರ್ಸ್ ಇಲ್ಲ ಇನ್ ಲಾರ್ಜ್ ಪಾರ್ಟ್ಸ್. ಒನ್ ಆಫ್ ದ ಇಂಪಾರ್ಟೆಂಟ್ ಥಿಂಗ್ಸ್ ದಟ್ ನ್ಯಾಷನಲ್ ಹೆಲ್ತ್ ಮಿಷನ್ ಡಿಡ್, even if it's not working so well, it said committees have to be formed.
Right.
At primary health center and at each village where health has to be discussed.
So it's the village health committee there in the rural
village
areas.
health sanitation committee, VHSNC ಅಂತ ಅದಕ್ಕೆ ಒಂದು ಸ್ವಲ್ಪ ಹಣನೂ ಕೊಟ್ಟರು. ಮೀಟಿಂಗ್ಸ್ ಮಾಡಿ, ಚರ್ಚೆಗಳು ಮಾಡಿ. ಈ ರೀತಿ ಚರ್ಚೆಗಳು ಪ್ರತಿಯೊಂದು, ನೀವು ಹೇಳ್ತಾ ಇರೋ ಹಂಗೆ ಪ್ರತಿಯೊಂದು ವಾರ್ಡ್ ಮಟ್ಟದಲ್ಲಿ ಪೀಪಲ್ ಸಿವಿಕ್ ಎಂಗೇಜ್ಮೆಂಟ್ ಇಸ್ ಆಲ್ಸೋ ಆಸ್ ಇಂಪಾರ್ಟೆಂಟ್ ಆಸ್ ಗವರ್ಮೆಂಟ್ ಎಂಗೇಜ್ಮೆಂಟ್.
Correct.
ಅಂಡ್ ಗವರ್ಮೆಂಟ್ಸ್ ಹ್ಯಾವ್ ಟು ಕ್ರಿಯೇಟ್ ಸ್ಪೇಸ್ ಫಾರ್ civic engagement.
The ASHAs and ANMs, they are in the PSCs. They also receive this kind of proper capacity building and training. They can go door to door. Anyway, they are going and providing services, vaccinations. They can also educate the family and community members. This is really helping.
ಕರೆಕ್ಟ್. ನಿಮ್ಮಿಬ್ಬರಿಗೂ ಈ ಸವಾಲ್ ಬರುತ್ತೆ. ಬಿಕಾಸ್ ಆಶಾ ವರ್ಕರ್ ಆಗಲಿ ಅಥವಾ ಹೆಲ್ತ್ personnel agli, it's seen as a health department
Yes.
issue. Do we not need to democratize the discussions further? And that is where I'm pushing this discussion, that there's an opportunity in Bangalore with the creation of the ward committees, proposed wards and 500 ward committees, to get this to be discussed at a community level and with the government as interface, right? ಆ ಥರ ಡಿಸ್ಕಷನ್ ಬಗ್ಗೆ ಏನ್ ಅನ್ಸುತ್ತೆ?
It's a very important question, especially in the context of Bangalore becoming 5 corporations. I don't know how many of us are aware about Bangalore's government health service. Bangalore's government health services is run by maybe about 5 or 6 departments. So there is BBMP, which runs health centers and health and wellness centers. There is state health and family welfare department directly running some primary health centers. BBMP running maternity homes. ESI, Labour Department, Government of India running ESI hospitals. CGHS, so central government for others. This is inherently inefficient, actually. No private company would have 5 different departments run different kinds of health services for different populations. Ideally, local government should eventually develop the capacity for integrating all of Bangalore's services and having the local corporation run and maintain its this thing. We are far away. I mean, it's a really idealistic goal, but we need to go there.
That's right. So that's the direction we should focus on, convergence, and convergence opportunities exist at the ward level if we are prepared to strengthen that structure of governance to bring together this various groups together, including private players.
The advantage in cities is private players. You take, for example, rural Karnataka or rural
Right.
India. We have an excellent system called the primary healthcare system.
Right.
So you have a primary health center and you have health and wellness centers, or what is now being called Ayushman Arogya Mandirs. And you have ANMs, you have ASHAs, you have health workers. So outbreak management in rural India, I would posit, is somewhat better structured than in cities.
And
Right.
working very well there.
And working quite well. If you have a diarrhea outbreak, you have you have a district officer, you have a surveillance system, you have a workforce, you have ASHA, and all of our rural populations are allocated to a specific health worker. There's one ASHA for every village. In Bangalore, the number of community health workers needed is very high. We have a huge deficit.
Right.
Every neighborhood needs to have a community health worker who is a link between, this kind of information. So let's say Swasti is doing this education. Somebody has to interface with, many of us don't know which is our local health center. Many Bangaloreans, rich or poor, we don't know which is our local health center. So a lot needs to be done on Bangalore's health, and it needs a kind of integrated public health approach rather than a medical approach.
Yeah, agreed his point. And when we are identifying the illness and even NCD problems also, when we are referring for further investigation and also treatment, and people are saying we don't know where is the PSC, where we have to go access treatment. Even though we are referring simply, if there is no access of treatment, again they are investing their time and they are not interested to go next time to access
Wage loss
treatment.
irutte alva?
Yes, wage loss.
So they have to.
Yes. That is even for example ESIC also. When we identify anemic cases, we are referring iron. There is no stock available. They come and say we lost 1 day wage, and also there is no stock. If you can give, that is well and good. This kind of challenges still is there. That's what we need to be understand what locally available, they can afford it. Accordingly educating them very important.
ಬಟ್ ಈ ವಿಷಯ ಇವ್ರು ಇವಾಗ ಎಜುಕೇಟ್ ಮಾಡ್ತಾರಲ್ಲ, ಈ ವಾರ್ಡ್ ಕಮಿಟಿಗಳಲ್ಲಿ ಇದು ಚರ್ಚೆ ಆಗ್ಬೇಕು, ಜನ ಹೋಗ್ಬಿಟ್ಟು ಕೇಳಬೇಕು. ಇಲ್ಲ ಅಂದ್ರೆ ಅದೇನಾಗತ್ತೆ, ಇಟ್ ಬಿಕಮ್ಸ್ ಇಟ್ ಇಸ್ ಇಂಪಾರ್ಟೆಂಟ್. ಒನ್ ಇಸ್ ಆಲ್ಸೋ ವೆರಿ ಇಂಪಾರ್ಟೆಂಟ್. ಬಟ್ ಫಾರ್ ದಟ್ ಟು ಟ್ರಾನ್ಸ್ಲೇಟ್ ಎಟ್ ಸ್ಕೇಲ್ ಇಂಟು ಅ ಚೇಂಜ್ ಆಫ್ ದ ಸಿಟಿ requires that kind of ward leveling.
Sukanya makes this very valid point that it's not just the problem identification, but the solution which is affordable and doable with the community. Those are the issues that we need to take a deeper dive. You're making the point that it should be discussed at a structural level so that the state can intervene to assist communities and individuals who are more vulnerable to find solutions for themselves. So these discussions of health are not limited to health alone, but it's a wider services, community governance issue.
I mean, linking this to climate change means that if we have a health service and a system which people trust and they know it will work, then things like heat stress, dehydration, preparedness to climate related issues, people know where to go and what to do. We have not yet reached there in terms of, I think, city health system. We really need to invest in Bangalore's health service and system.
And also adding his point, very valid point he added, climate change is extreme event kind. It is not one time. Every year we are seeing frequently of increasing thing. And I believe, and Swasti also, we work climate change very related to health. Okay, because of all the season. For example, summer extreme heat, heat stroke and all, many health issues. And also rainy season, this is waterborne diseases, vector-borne diseases also increasing. And even though winter and extreme cold also, even though what we have observed in the community, major health issues, they are walking to our wellness center also, respiratory problem, wheezing, breathing difficulty, and running nose, and very pain, joint pain. And also they mention especially the skin related also, cracks and irritation, itchings, these kind of small illness, expressed illness also they are facing it. That's what we should do, preparedness. A very climate changes.
So that's one very interesting question that I will come to, and Prashanth, you can also pick on that. Does an advanced warning in terms of meteorology, in terms of understanding what we are going to face in the coming 1 week, does it help in the preparedness?
Yes.
Can we put out health bulletins saying be prepared for an outbreak of dengue because it's going to rain in the next 15 days and mosquito breeding can increase? So these are examples of.
Yes. Swasti, we work and we are doing and research and doing analyzing the trends, what exactly trends, and also what is the upcoming outbreak.
And you're putting it in public domain.
Publicing out. And also we are educating community. These are the things will going to happen. What preparedness they can do, what prevention measurement they can do. We are developing locally, contextualized, very relevant to that particular community, and pictorial, local language.
Very nice.
We are educating them.
Perfect.
I just want to couple that.
Please.
I want to put a red flag there.
Yes,
we have to put out the early warnings and we should use data and empower citizens with information. But if that information is not coupled with health services, which is prepared for these spikes, which is in advance ready with medicines, diagnostics, and health workforce necessary, motivated health workforce, this extra awareness becomes just an individual education. It doesn't transform into systems change.
Oh, that's right. So it's like when you're anticipating flooding, you're ready with the pumps, but then you're also ready with mosquito fumigation, for example. That system has to be ready to act on the warning notices that we get. So final thoughts on how we can engage communities and the state together to solve the kind of challenges that we have.
So climate change, nan prakara, I mean, I'll just take a minute on this because so much literature in the West about eco anxiety and how young people ge climate change inda ಏನೇನೋ ಆಗ್ಬಿಡುತ್ತೆ ಅನ್ನೋ ಭಯ ಎಲ್ಲ ಶುರು ಆಗಿದೆ. On the other hand, in several parts of rural Karnataka and also in many parts of Bangalore, what I see is not so much an eco anxiety and high awareness of climate change, but rather people being stuck in very basic existential issues.
Right.
Clean water, school,
Housing.
employment, housing. So real action on climate change, frankly, can only come if we fix some of those deep inequities.
Right.
Because then a free citizen is able to think in this manner, is
Right.
able to think, what can I do to address climate change? So that has to be fixed.
So when a city claims $350 billion as its annual GDP, it can do better in terms of increasing livability for its citizens so that they're better prepared for climate change and the health consequences. So thank you for this very deep conversation and very grounded conversation. You're bringing experience into play, but you're also looking at it structurally and at a city level. As you can see, health itself is a complex issue, but there are opportunities with the city because we know what the challenges are and what the problems are. And we have to fix it structurally. The ward committees and the reorganization of the city itself gives us a great opportunity to push the idea of better health for all in Bangalore. Let's see whether we can make use of this window that is open to us over the next coming years and take action to make this one of the better cities in terms of health of its citizens. So Vishwanath for Bangalore Sustainability Forum, and thank you once again.
Thank you.
Dr.
Thank you.
Prashanth and
Thank you
Sukanya.
so much.
ನಮಸ್ಕಾರ ಬೆಂಗಳೂರು, ಹೇಗಿದ್ದೀರಾ? ಆರಾಮಾ?
ಒಂದು ಕಾಫಿ ಅಣ್ಣ.